Good morning, everyone. Thanks for joining us here. I'm Mike Galloway, the CAO for the County of Essex, and with me today are the Warden Gary McNamara and EMS Chief Bruce Krauter. As you know, the County of Essex activated a local emergency at 8:45 this morning in response to persistent offload delays, which are causing situations when there are only a limited number or zero ambulances available to respond to emergency calls. While this is a province-wide problem requiring provincial action, the county felt it had to take urgent local action to protect the health and well-being of Windsor, Essex residents. Activating the state of emergency will give our healthcare leaders more tools to address this crisis, and it will bring together a community control group of experts to monitor the situation and work to keep our community as safe as possible, and our paramedics on the road. We are committed to keeping the media and public informed as this situation develops. I'll now turn it over to Warden McNamara, who has a number of comments, and then we'll go to Chief Krauter after that.
All right, thank you very much, Mike. And the County of Essex did not make this decision very lightly, and we made it only after careful deliberations, and only because we believe it's the best mechanism to address this crisis locally. While offload delays are a province-wide problem requiring provincial action, we are feeling the impacts locally and have an obligation to do everything we can to improve the situation in Windsor, Essex, for the good of our residents and for our paramedics. Code reds and code blacks are not a new phenomenon. They would happen in the past as well, but not as often and not as for a long and period of time. They certainly wouldn't affect multiple ambulance services at the same time, rendering shared service arrangements all but meaningless. But last Wednesday, there was hardly an ambulance available in all of southwestern Ontario. Locally, we had 26 ambulances rostered, but all were offload delays outside hospital emergency rooms. The current situation is unsustainable, and it is putting the lives of Windsor and Essex County residents at risk and negatively affecting the morale of our hardworking paramedics who want to be on the road responding to emergency calls, not sitting idly outside ambulance bays. This local emergency will provide us the flexibility and certainly the tools to respond to this crisis, and it will highlight for the province just how important it is for them to address this crisis, for Windsor and Essex County residents and for all Ontarians. I'll now turn it over to our Essex-Windsor EMS Chief, Chief Bruce Krauter. Chief?
Thank you, Warden. Thank you, Warden, and thank you, Mike. In all my years of working in EMS, and that counts 2 years dealing with COVID, I've never seen our local healthcare system in such a state of crisis. Code reds and code blacks are occurring with alarming frequency with no end in sight. Today's emergency declaration will empower us to address this crisis locally and employ a Made in Windsor Essex techniques and tools to ensure the safety and well-being of our residents and visitors. The offload delays of our ambulances are experiencing are not the fault of our hospital partners. I want to stress that. Our hospital partners are not at fault with this. We've worked with them to reduce offload delays, and we have encouraged the residents to seek alternate forms of care for non-emergency cases. But this problem persists and has grown worse. The causes of offload delays are complex and relating to long-standing issues of hospital capacity, patient flow, a lack of local primary care providers, which causes increased usage of 911 system. Essex-Windsor EMS transports account for 35% of emergency room visits compared to the provincial average of between 10 and 15%. That fact alone is unsustainable. We recently met with the Ministry of Health officials and offered them suggestions for dealing with the offload delay crisis province-wide. We are hopeful those discussions will bring about necessary changes in the longer term, but felt it imperative to take this action in the shorter term to protect the health and well-being of our local residents. Essex-Windsor EMS requires the following changes to deal effectively with this crisis, and will work with our partners to realize them. Increase capacity within the hospitals to move admit no beds out of the emergency department to allow ambulances to offload immediately. The ability to treat and refer low acuity patients on scene and divert away from the emergency departments. Ability to place a clinician in the dispatch center to triage on the phone and refer patients to alternate care. Primary care providers, open hours to be conducive to the public need. And then finally, develop a plan that when code red and blacks occur, all stakeholders are brought in and react in a positive way. With that, we'll welcome any questions. Thank you.
Yeah, so questions, maybe if we just do one each, we'll come back around if you have a second question, but yes, go ahead.
What exactly does the state of emergency do to alleviate the situation?
The declaration of emergency, so it's not a state of emergency, but declaration of emergency, allows us to bring together our community control group, which number one is community leaders, senior leadership team, but also other community stakeholders such as the hospitals, Ontario Health, the Ministry of Health, our dispatch system, get all of those leaders at the table and go, okay, what are we going to do and what do we need to ask the province for? So that we can get the resources here to get us out of this crisis in the short term, but also in the long term.
How long does that last officially?
The state of emergency or the declaration of emergency will last as long as until we don't have offload delays and we're not into code reds and blacks.
Can you walk through in more layman's terms what you just described in terms of all those changes, just so people kind of get a handle on, okay, if I call an ambulance, what's going to happen?
So what we'd like is to have a clinician, whether it be a nurse, a paramedic, nurse practitioner, somebody with some medical background in our dispatch center. So for the low acuity calls that we transport to hospital, they can talk to them on the phone and determine whether, number one, they need to go to the hospital, and number two, where we can get them the proper care at the right time and at the right place. Because most of the time, the emergency department may not be the correct place for the patient to go to. The next one, and I'm just going to flip back to my notes. So the other one is to treat, release, and refer patients by paramedics on scene. Similar type of issue. Right now, under the Ambulance Act, we must transport people to the emergency department. We want the leeway, we want the openness that if we can transport them or have them referred to their primary care provider, a pharmacy, so they can seek their care elsewhere than the emergency department. This way it creates capacity.
So that's for people who aren't like having a heart attack, really
Correct.
major trauma.
Non-life-threatening, lower acuity, some of those illnesses. The other ask is that primary care providers, because we're finding out the majority stay open on business hours, we may not have a great influx of primary care providers for after hours and on weekends. If we can get them to expand their hours so that people have somewhere to go, especially with urgent care centers.
So does that mean like a doctor's office? So just-
Yes, doctor's office.
So is a lot of this that's being done right now pretty much like a pressure valve, taking pressure off somewhat, but in the long term, much bigger solutions need to be found?
Yes, so right now we want that pressure valve, you're right. Get the pressure valve off so that we can get patients offloaded into the emergency department that we need to. The other big piece is we're bed blocked right now. I just heard a report this morning that currently we have, I believe, between 40 and 50 patients in the emergency departments that are waiting for beds upstairs within the hospital. Those are 40 beds that the EMS service could use to offload patients. We have to find some place that those patients can go to await admission into the hospital other than the emergency department.
You said that Southwestern Ontario is all experiencing similar situations. Are you guys the first to declare an emergency like this?
I believe we are the first.
Do you think you're the only?
I'm not sure. There's been discussions amongst my colleagues asking how we're doing it, why we're doing it, and I would suspect that there may be more that will declare the emergency.
And just to follow up, why were you the first? Why did you feel like this was the urgent need to do?
The urgency here is we're different than other areas within the province. We are a peninsula. We're surrounded 3 ways by water, and our counterparts to the east have limited resources to help us. The only way to do it is to declare the emergencies so we can figure out what we need so that we can ask the province to assist us to get us out of this crisis.
Were you finished walking through all the steps?
I believe so.
Okay.
Just a point of clarification, Warden McNamara mentioned 26 ambulances were rostered but unavailable. What does that mean?
So what that means is on a day, today for example, right now I believe we have 26 ambulances on duty, on duty. On that day, we had 26 ambulances, but they were all at the hospitals with their patients unable to offload. So all of our complement was there. Chatham-Kent was experiencing the same issue, as was London, and I believe Elgin County was experiencing the same issue. So if you want to put it in layman's terms, from Woodstock, basically, to the Detroit River, we had very much limited ambulance resources to respond to an emergency.
So what's causing all this?
As I said, there's numerous factors. Flow within the hospital, meaning the patients moving up to their rooms and then discharged from their rooms back into the community. The other piece is the overutilization of EMS. That one statistic that we're transporting 35% of the population. How do we get that to the community to say maybe we aren't the best? There's the other issue of primary care providers could open up their hours to allow that capacity and allow the public to see them when the public needs to, not necessarily on office hours.
Couldn't there be EMS staff who tap out the team on the road who could be on site at the hospital and allow the crew to go, or is that?
We do that now. We will replace crews on ambulances that are on offload delay, but you have to understand that last week we had ambulances on offload delay 12, 16, 24 hours. So that would mean that we'd have 2 to 3 crews rotating through one patient waiting for them to get a hospital bed. That's just unsustainable. And we go back to what Warden McNamara said, the morale of the paramedics is at the all-time low because they're on the offload delays. They want to be out responding, and this is one tool that we can do to help them out so that they can do their job, so they're not sitting in hospital waiting to offload.
So what's the message to the public then? I mean, we're hearing all this information. This is what we need from the province. This is the situation we're up against. But if someone has made that decision to call 911, whether in a medical setting it's life-threatening, not like for them it's an emergency. So what's the message to the public if they're about to call 911 for an ambulance?
So right now, it's our plans going forward, very much in the short term, are similar that we have been doing over the last few years. That when we get into a situation where we don't have the ambulance to respond, some calls will go into the queue. Life and limb, life and death, where it is severely acute type of emergency, those are triaged, and we should have resources going to them immediately. When they go into the dispatch center and they are triaged and it's a lesser acuity, it's not life-threatening, those are triaged and we may have to put them in the queue and they may wait. We look at our community partners such as the fire services and even the police departments, how they can help us out in tiered response. I want to assure the public that this is why we're doing this, is so that when we get into those situations, we have a plan and that people don't wait. You're correct. A low acuity, somebody says it's an emergency in my eyes, but we have to triage it correctly so we send the right resource at the right time.
So Wednesday, October 12th was a code black,
Yes.
but QP representing Essex-Windsor EMS paramedics have warned of code blacks occurring previous to that.
Yes.
Do you know how many occurred this month so far?
Where we're at right now, thank you for the question because it is a good question. So code blacks, sorry, I just got to get to my spot. So far this month, October, we're at 491 code blacks that were issued. Last month, this was for the full month, 116. We've quadrupled our numbers. The code blacks before that were referenced by QP were very much short in duration. We'd go into code black and back out, back into code black. They'd only happen for minutes at a time, whereas now they're getting more frequent and they're getting longer. That's hence why we've called for the declaration of emergency, because we can't sustain this.
Could you repeat that number just again?
Yeah, so far this month, and this was printed out on Friday, 491 in October.
Essex-Windsor EMS alone?
Just Essex-Windsor EMS, 491 code blacks. In September, 116.
So far in October, 491. In
Yes.
the entirety of September, only 160.
Yes.
I wouldn't say only 160.
Sorry. Well, actually, on that point,
Yeah.
QP representing Essex-Windsor EMS paramedics have been talking about code blacks for, it seems like a year and a half now.
Yes.
On social media. Why hasn't something like this happened sooner?
Again, as I stated earlier, the duration of and the frequency of wasn't as high as this, and it was manageable with that. I understand that QP did speak of it, and we were addressing it at that time. And we were managing it at that point, but now we've come to the point that we have to have a better plan. We have to have better supports both locally and from the province.
Do you think this state of emergency will result in more people being sent to long-term care homes farther away in order to fear for beds in the hospital?
I think that's an alternative that the hospitals can use. Is that going to increase that frequency? I'm not sure. We are going to be having a meeting with Ontario Health and the hospitals this afternoon. I'm sure that's one of the mitigating factors that may help with this. But I can't speak of if it's going to increase or decrease or where that's going to go.
Now, when you declare the state of emergency for Essex County, is it really because you're sharing with Windsor? It's also kind of a state of emergency for Windsor too? Is that?
Yeah, so we're the designated delivery agent for EMS for the region. So we cover the county of Essex, the city of Windsor. It's not really required that the city of Windsor declare an emergency for this fact because we're the delivery agent and we cover all of that. And the declaration actually covers all jurisdictions where Essex-Windsor EMS may transport to. So that could be Chatham-Kent, that could be London, and if we have to transport people to Toronto, it would impact that as well.
What conversations have you had with the province about the situation here?
We've had ongoing conversations with the province, and the warden at AMO spoke to the minister's office in giving them suggestions. We meet with the ministry regularly and give them suggestions and ideas, and the Ontario Association of Paramedic Chiefs have written a white paper of what could be put into play to assist not only Essex-Windsor EMS, but across the province.
Can you estimate or break down how much?
The one question thing I guess didn't work.
No, we're all asking the same thing. Break down, so when this goes into effect, could you break down the percentage of the non-urgent stuff that will now be shifted over to something else other than an ER, and then what percentage of your calls are the really urgent care stuff?
So I don't have the numbers in front of me. I can get you those, and I can send those out through Dawn. But just off the top of my head, of our emergency response, that's where an ambulance goes out, lights and siren, suspected life and death call. We transport those back at a lower acuity, urgent type of response back at about a 60% rate. So they're not all life and death. They are more of a urgent nature. And that just goes to show with the ministry how the dispatch system is somewhat fractured. It's still built on responsive of everything's an emergency, but obviously that's not the case.
So the state of emergency could divert 60% of your calls away from the ER. Is that the idea?
Well, I think not 60%, I think that's a high number. I think if we can divert 50% or 40%, that would be more realistic.
So that's what you're hoping for?
That's what I'm hoping for.
Right.
What I'm really hoping for is that the ambulances that arrive at the emergency department get offloaded as soon as they can and not be on offload delay greater than 30 minutes. That's my ultimate goal.
You've had these discussions with the province. What are you hoping that making this declaration of emergency does? Just kind of light a fire under their butt sort of thing? Like what is it going to do if you've already had these conversations with them?
We've had the conversations both at a provincial level and a local level. I'm hoping that with the declaration that we can get all of our community partners and the province at the table so that we can get some really concrete action on moving forward, so that we're not just getting discussions, but we're actually getting resolve. to some of these issues. That's my ultimate goal.
So since you've made this declaration, have you set that up? Have you heard from the province?
We have heard from the province this morning, and they were waiting to discuss with us after this press conference. And we are going to be having our community control group meeting this afternoon at 4 o'clock, where we've invited them plus all of the other stakeholders from around the community.
Okay, that's good.
I just
go
want to
ahead.
add one
Warden.
piece too, and I think, as the warden as well, in the discussions over the weekend with our team, one of the biggest concerns that I have is we haven't even hit yet the flu season and what the COVID new wave, as they were anticipating, we're seeing numbers going up. And so that could be a real impact as well to our EMS services. And I'm really concerned about that. And I think the rationale is to try to be ahead of that issue so that we can have at least a means to continue to deliver the good, solid, efficient, and safe service to each and every resident in Windsor, Essex. So keep in mind, this is mid-October. Flu season is going to start, and in particular, and so I do commend our chief and certainly our CAO, and I want to stress this didn't come easy. I had a lot of questions to them leading up to the declaration, but I really believe that it's the right thing to do at the right time right now.
Do you feel that there's more funding needed to come from the province to hire paramedics or more staff serving in hospitals?
I would always welcome more funding for paramedics, but if we can offload our ambulances in a timely fashion, I believe right now we do have a good complement. Where I'd like the funding to go is even to the hospitals, that if they can open up more beds and open up some more infrastructure, and I think this is kind of the impetus as well of what facilities we have here. We have to get that moving and moving in the right way. But the big thing, I would welcome funding, but I think if we offloaded in an expedient manner, I don't know if we have to put more ambulances on the road. It's how we use the whole system wisely.
What about ER staff? Like, how many doctors do we have in there looking at people when things get high?
I really can't answer that. I don't know how many they staff, but that's a hospital. But funding to the hospital, I think, to up their staff would help out tremendously and open up beds. And are there beds in the community that we can open up with some funding? I can't answer that.
And I think the system is strained, there's no doubt. I mean, obviously COVID's taken a huge impact on staffing. There's burnout. We've seen the tremendous stress that our nurses have gone under. I mean, that shouldn't be news to everybody here. And it's impacting on how they deliver. I mean, our paramedics, we see it in their faces. And it's even on recruitment. It's not as if we didn't try to recruit and so forth, but it is difficult at this stage here. So the system, it's a big domino. I mean, if you put more money in EMS, I'm sure the chief will say thank you very much, but I don't think that's going to solve the problem. I think that question had been asked a long time ago, and the whole system has to be working cooperatively together, from the top to the bottom. If there's any weakness within the system, it's going to affect how the delivery of service is done. So I'm glad at least they're going to be sitting around the table, start talking about measures that will help alleviate the services. And I certainly don't want to see a 300% increase in November over the October numbers, because that would be not only shocking, but it creates some real havoc in the system.
Is that the percentage increase, 116 to 491? It's 380%.
Yeah, well, you look at 491 versus 100, so that looks like about 300% increase.
Could the crowns and the TLCs, the transport world, be brought in to help some of this transport ambulance?
They are. They're already working right now with Windsor Regional Hospital and Irish Shores Healthcare, that they have ambulances not ambulances, transport vehicles on contract with those facilities, and they move a lot of patients right now. Could we use more? Sure. But how do we do that?
Well, I know-
That's why we have to have the community control group together to ask those questions and see what we need so that we can ask that of the province as well.
Yeah, who is the community control? Who is that?
That's what I said, the senior leadership at the County of Essex. So myself, Treasury, Legal, HR, the clerk, the CAO, and then we bring in other stakeholders from around the community. So the hospitals, the fire chiefs, because they're for the lower tier municipalities, the dispatch center, the Ministry of Health, and Ontario Health.
So that's a meeting this afternoon at 4.
That'll start at 4, and then we'll have those regularly, daily.
Will there be any kind of release today about any outcome from that meeting?
It'd either be today or tomorrow, but Don will also be at the meeting for communications, and we will be developing that. We have a communication plan, but to get that back out to the public and through media resources to give any updates. I think that was right at the beginning, that we're mandated and we're committed to keep the public informed about this crisis.
Yeah, we'll give updates on a regular basis. Yeah.
The other thing about the transport, I just wonder if their role could change under this, like going out and actually responding to a call or anything like that.
No, they're not licensed under the Ambulance Act, but that's something that we will talk about, and maybe their role could be an assistance. We just have to look at that, and that's under the guidance of the province, obviously, because they're the ones that are the regulators.
Okay, Chief Krauter and the Warden will stick around if you have any individual questions. Other than that, we'll end the press conference. Thank you.